Well, hello and welcome to PM Express. 6 years of being cheated is enough. Lab technicians threatened strike, and for the past 2 weeks they've been cautioned with red bands and temporary withdrawals. But finally, today, 28th of May, there's the full withdrawal of all lab technicians, and therefore it's unable to check your blood count or get blood or get all your test results. But how vital is it and how dangerous is it within the medical fraternity? Are there any bypasses if the lab technician can't do it? Can we consult the nurses or the doctors? If so, or if not, are they going to heed to their call? Because they are saying that since the simple single spine implementation, they've been downgraded and that they've been treated unfairly. Therefore, unless it's been rectified, they are not going back to work. But they are essential service providers, and essential service providers are not supposed to go on strike. But when the voter finally, engulfs the frog, probably, makes a funny noise. And here they are making a funny noise saying that they have been cheated for too long. How do we resolve it? And that's what we are talking about. My name is Nana Ansakwa IV, Chief of the Little Republic of Akwamu Edumas. When I come back, I'm talking to two fine gentlemen within the medical fraternity to find out how serious it is and how it is we go forward in resolving it. Don't go. Well, thank you very much for staying with me in studio. Michael Amo Omare, General Secretary, Association of Medical Lab Scientists. Michael, you're welcome.
Thank you, Nana.
And then I have with me Dr. Gabriel Bananko, who is the President, Coalition of NGOs in Healthcare. Doc, you're welcome.
Thank you.
Great to have you back on the show.
Thank you.
But I think we'll start with Michael. Michael, is this the only solution?
Thank you, and good evening to your viewers. This is not the only solution, but we have come to a point where this has become the last resort.
There couldn't have been any negotiations. Nothing could have been done because you are the service. You provide a really vital service. And lives could be lost, people could be maimed, disabled. Is there any way you could have continued service and then we come to the table and joy till we get to the end?
Like I said, this is not the only solution. Why we have come to last resort. We started not today. These issues that we have put in play on table for the request for creation of Directorate for Medical Laboratory Science, and then the fencing of the income generated so that we can continuously provide uninterrupted services to our clients has been on the table since 2010. Because of this current situation, there was a situational analysis conducted in 2010. This led to development of National Health Laboratory Policy. When the policy were about to be implemented, there were protests from other sectors, and then the policy implementation were halted. Since then, there had been a lot of negotiations and consultations and what have you, to the extent that this issue even went to Labour Commission 2016.
Okay, Michael, I think you need to speak up a bit for the viewers.
2016, and it could not be resolved, and the last government, the past government left office. When the new government came, we were asked to consult with the current minister. We have had series of meetings with the minister, and it has not been resolved, to the extent that now when we go, the last time we sought for his intervention, he asks whether we are bringing new thing on board or is the same old thing we are asking for. So it has come to us, we have got to realize that they simply just don't care about our matters. When we sent caution, it's just about 2 weeks ago, we started with the wearing of red bands. Nobody cared. Then it went to work to rule. We were nobody even called us for anything. So I think we still need to get to this stage. Maybe this is the language that they will understand better.
Okay, I'll come back to you, but Doc, how is this affecting healthcare provision? Even in the best of times, we struggle. How is it affecting healthcare production?
Yeah, thank you, and good evening to your viewers, Ghana. I just want to bring this point before I give you the situation. The association or the professional of this biometric medical laboratory scientists or professionals are indispensable. They play a vital role in preventive health as well as curative health. And so if you look at the continuum of care, you cannot do anything without their professional service. Whether you want to take a decision, whether you want to refer, whether you want to predict, you have to sort their professional competence, their services. So it helps you. Any other health, not only the medical doctor, any other health worker will need them before they can take a decision. Already in Ghana, they are very few. They are not much as we desire by the WHO standard. They are not enough. 2, they are not having the required tools or equipment that we desire to have provided comprehensive laboratory services to us, especially in the public facilities. And now we find ourselves for they having to lay down their tools to demand for their constitutional right. There's nothing wrong with asking for their constitutional right, because we all have to. The situation as at 30 minutes ago, I tried to find out, and most regions hit were the eastern region, Ashanti region, and the Brown Ahafo, Sunyani to be precise. There are agitation here and there. There are people surprised about, because they never thought that this could happen. So, because it's the early stages, we are not getting the real impact. So far, we have not identified any casualty yet, that because the person needed a laboratory service for prescription or diagnosis to be meted on the person. We have not yet had any unpalatable situation, and we thank God for that. But today I sit here to talk critically about the way we treat our general workforce, more especially in the health sector. Remember this issue, and the Ghana Medical Association issue came out, especially in 2015, very seriously, where civil society have to talk. In fact, almost a month, we have always been on radio, TV, talking about it. I think the Ministry of Health, Ghana Health Service, need to be much more proactive than what is being done. You see, we cannot compromise health. services. As much as we cannot compromise health services, we also have to be very, very respectful to any other medical or health professional, because they all complement the same, to achieve the same vision. And so today I want to plead with the two parties or the stakeholders, because this has to do with the Fair Wages Commission, this has to do with the Ministry of Employment and Labor Relations, and this has to do with the Ministry of Finance, and this has to do with the Ministry of Health. In fact, what we noticed in 2015, when the Ghana Medical Association went to strike, we noticed that these ministries that are supposed to be sitting on a table to resolve the issue were not meeting. You see, so they keep on compounding the problem, and they give the blame to the people who are on strike. But instead of they to sit down to look at the whole issue holistically and then begin to make amends, because they have the right. They are also the employer. They also have the right and responsibility to meet certain demand. I'm sure if they approach them with a half meal, with a proper, realistic timeline, they will not do what they are doing. So whereas I'm talking about the Ministry of Health and other associated ministries that are supposed to sit on the table to respond to this crisis, I also want to play with my good brother Mike and his team, that the ordinary women, the ordinary children, and the aged, more especially, who have to go through quick diagnosis services anytime they are at the facility, they will suffer more.
On that note, let's listen to what some of the ordinary women and ordinary children are saying when they go to the hospitals.
They are telling me they are on strike after asking me to come today. So do they want us to die?
That was how frustrated patients who visited the Central Laboratory at the Korle-Bu Teaching Hospital felt after they were refused healthcare by laboratory scientists. The patients, mostly pregnant women due for delivery, will have to wait until the laboratory scientists change their minds about the withdrawal of service.
From last week, and I came to the maternity and they asked me to come for the lab and scan. When I came here Thursday, they asked me to come Thursday, Monday. When I came, they said they don't work. So I don't know how to do, because it's my time.
So basically, I'm seeing that you are due.
Yes, even I can't even do anything, because when even it's not easy for me from house to here.
By no say Friday is me by.
I was asked to come on Friday, but it was a holiday. I'm here today and they are saying they are on strike. So even emergency services are not being attended to. Are they waiting for all of us to die? We are pleading with the government to listen to the lab technicians so that they pay attention to us. It's really painful to be denied treatment when you have the means to pay.
Tia paban chow on bomb near Yentimima Messa and Wayare.
Try and send me one doctor. Metamos Swasso. Within this week, I say, many lab.
Well, this is a direct emotional blackmail to Michael Mary. How much more money are you asking for, or what's the difference that cannot be settled?
Thank you again. It's not money we are asking for, though the money aspect is there. But one thing we should know is that nobody takes delight in seeing patients in this state. They are our clients, and they are the reason why we are there. However, it will also not be fair to the clients for us to continue rendering the services that we are rendering where we cannot guarantee the quality of services that we are giving. So what we are pushing for now is for the interest of the clients more than ourselves. We know that any of us can be a patient. It's today that I'm talking here that you are calling me a lab scientist because I have health. Tomorrow, if I fall sick, I'm also a patient. If the system are not properly put in place the way it should be, what sort of treatment am I going to receive? That is why we are saying that we cannot continue. Ghana in 2017 adopted international standard ISO 15189, and section 4 of this ISO talks about all these demands that we are making. These things, the structures has to be properly put in place.
Let's list the demands. Number one is what?
One, we are asking for directorates, creation of directorates for medical laboratory science from the ministry through the Ghana Health Service, teaching hospitals.
At the moment, you are under what directorate?
We don't have any directorate. Most are often issues concerning medical laboratory at facility levels, teaching hospital levels, are referred to the medical directorate. Meanwhile, the medical directorate's main concern is for the medical officers. So sometimes issues concerning laboratory, when it gets there, it's not properly addressed. And because we don't have a representative at the Ministry of Health and the Ghana Health Services, decision making is always short, or is always afterthought. The lab is not involved, so it is after all things has been considered, then someone thinks, so let's look at the lab, and it is not the best. As we see, because of this, the administrative and technical structures are not well coordinated in the country, and we are saying that we cannot continue to do this. The laboratories in Ghana here are even fighting for international accreditation, but because we don't have this, all these coordinations are not there. We started somewhere 2013 and enroll some laboratories in what we call SLAMTA, stepwise strengthening of medical laboratories towards accreditation. We did all these things, but because the structures are not well organized, there's no single public sector laboratory in Ghana here that have international accreditation. It is only the 37 military hospital laboratory that have accreditation for a section, not the complete laboratory, but a section of the laboratory, and it is not the best. We have Korle-Bu Teaching Hospital during the SLAMTA, Korle-Bu Teaching Hospital. We have, I think, 8 laboratories in Africa here had 4 stars. Out of these 8, 5 were from Ghana. Yet, because of these shortcomings, none of them has got accreditation up to date. And when you go to the public sector laboratories, constantly you will hear of service interruptions. Even some of the facilities cannot give you the services that they are supposed to give. Some can do only blood film and HB estimation. All the other services, they will tell you we cannot do it. Meanwhile, personnel are there who have been trained, though the number is inadequate. The few in the system have been trained and trained well who can render these services, but because of the logistics and the other shortcomings. So we think this time around, those things have to be provided. We cannot continue like this.
So At the moment, you're striking till when?
At the moment, two things. We pray God tomorrow we will be meeting the ministry. We pray God that when we meet, they will understand us this time, and then we all come to a compromise when we see a roadmap that these things that we are asking for will be granted. Or the members, you see, this strike was not a strike that was called by the leadership. It is the membership across the country. So if membership also comes and say, let's call off the strike, leadership have no option. We will call off the strike immediately.
Do you feel that within the medical fraternity, there's this looking down on the lab technician?
Definitely. It is not just looking down. The laboratory services per se, not the laboratory personnel. The services have been marginalized for quite too long. And this has led to the situation that we find ourselves in.
Maybe it's an unfair question, but what brought about this culture? Because, you know, anytime you say medical fraternity, all we think of is the doctor. Everybody else seems to be secondary, but we all just think medical fraternity is about 90% doctor. But then I think if you all don't come in, the doctor is, you know, as good as I am sitting here.
It's how we developed ourselves as a country. That is one of the reasons why we are having this. For instance, the medical laboratory scientists, or the medical laboratory science practice started about 46 years ago or more, but it has not been developed. In the past, we had only one school that was training medical laboratory technician. At that time, the technician was the certificate holder. The whole country. If you want to do diploma in medical laboratory, then you have to travel out of the country. So practitioners at that time felt that the medical laboratory scientist is not knowledgeable. Because
it's like a failed doctor.
Compared to doctor or pharmacist. Actually, personally, I don't like that sort of professional comparison, so I don't do it. Because it was only one school, those days they were taking 12, maximum 20. So they were bringing people who come out of school and train them on the bench. Just small training that, let's say, for instance, your role is to pour water into this grass alone, and then they will be calling that person a laboratory technician. But as time goes on, the profession has developed. We graduated from the certificate, the diploma training started. Now all the universities are training degree holders, and some of them have developed. Some of us have developed to the master's degree and PhD degree. But because it started like this, there are a group of people who are still thinking that the laboratories, medical laboratory scientist is not self-sufficient to decide or to lead itself, and some other professional groups should lead the medical laboratory science. And this is what we are saying, that we have come of age. So these things should stop. And because of that, anytime we make requests for improved services so that, for instance, the population may know the good work that we are rendering, we will meet challenges at the decision-making level.
Let's listen to the PRO, Minister of Health, Robert Kojo, get the government's response on this issue.
Very much. We are very much aware about the strike action. undertaken by the Ghana Association of Medical Lab Scientists. I would say it's rather unfortunate because we've been engaging them on this very issue for some time now. The minister has been so kind enough to be listening to the issue, and it's quite a complex and a dicey one because of some of demands from them.
But I'm sure you are aware that they drew a roadmap since January this year.
They did.
Outlining how they were going to take the strike action one after the other. So if you remember, they started by a march, then they embarked on withdrawal of services, then emergency, and now
complete
all services. Why did your ministry wait till now to see these people embark on a total withdrawal of service when you think that you could have solved it earlier than today?
Well, most media houses keep asking this question, something that either we are not doing much, we are not being proactive, or we are not fast-tracking some of these issues. That is not the issue. If we're outside, you may think that is it, but that is not the entire issue. Because the Ministry of Health, as it is, has about 27 agencies. And there are so many splinter groups, so many associations that you can't even count them. So if you are educating any issue, you are handling any issue, and you are not very careful, you don't bring all the other groups together and handle it once and for all, you wouldn't see the light of the day. That will go against the patients that we are all taking care of.
But Mr. Kudu, you agree with me that, for instance, with the issue of the salary, we have been complaining since 2012 that ever since the single spine salary was rolled out, they haven't been migrated on this particular policy. And it's been 6 years since they've been calling for this, and so they are asking that you do something about it. Is this something that your ministry is having an interest in, to ensure that they see an upward adjustment of their salaries so that these people can go back to work? Because they're saying that you're not going back until these issues are resolved.
Well, I don't know whether, I don't have that fact, whether they are on it or not, or they are on it, but the level is not what they think is proper compared to their colleagues in other health professional fields. But the issue of salaries, this is not the only body or association that has something to say about salaries. Even their colleagues, the Ghana Medical Association, they've also been fighting about their condition of service, their salaries, the market premium. We are also discussing the issue with them. We've been meeting them, and I believe we've gotten to a point where it's like the government is meeting their needs. The same way we expect our brothers from the lab science field to also do the same. They've been engaging, all right, but if we're talking about 6 years, the question is, why wasn't done at that time? The minister is still engaging, still are discussing the issue with those who matter to see the way forward. But I'm pleading with my brother friend, Dr. Ignatius, the president of Ghana Association of Lab Technicians or Lab Scientists. I'm pleading with him. He's been frequenting this ministry. Nobody has turned him down. We've asked them to be patient whilst discussions continue. For the sake of this nation called Ghana, and for the lives of the innocent patients who, without the fault of theirs, will find themselves in this situation, we're pleading with them to at least put an end to their strike. If they can go to work tomorrow, we'll be very happy. Because the minister is ready to engage them further. Now, bringing all the three interested groups together at a roundtable discussion, and then bring finality to this.
So that's governance response. Also to go to Doc, but let me come to Omari to say, look, who are the three interested groups?
In fact, I may pardon my friend Mr. Kujo, because it is clearly that he is not on top of the issues and he doesn't know the demand. Which group is interested in the single spine that we are asking for? We don't know. Which group is interested in the laboratory funds that we generated that we want to create a fund sum for continuous services? Or the directorate? Which groups will also want directorate? Or in that matter, if he's claiming you have about 27 professional groups. So if one of your children is hungry and you are a father and they say, give me food, you want to tell him that wait until all my children come together before you will be fed? Or wait until all my children cry that they are hungry before you will be fed? Unfortunately, what he is saying is not this. The condition of service and others, we also have problems with condition of service, but we have not put it here. There are more issues that if the laboratory wants to list them, we cannot talk about them now, but we are saying that these three are very vital and we need to resolve them. I will plead with him, he should go back and read the records, and then he will see that what he is saying is out of context.
Doc, let me go back to you with this, the focus of medical provision being so much on the doctor, where everybody else seems to be neglected. And that's what's causing this laboratory agitation.
Yeah, globally, everywhere in the health system, that is the perception. The mainstream people that we meet quickly, or those people after diagnosis that will, after the laboratory services that will write for us to pick something, we tend to cherish them more than the one who does the behind the scene. And just like in your studio here, it's not you who do the trick.
There's Aisha behind the screen.
Yes,
there's
somebody
forcing behind the screen.
Yes, somebody is behind the scene who is performing the magic. That is how the medical field is like. So there will be a lot of articles, researches indicating, so other countries have moved. They have changed the way they do things. The medical biometric scientists or professionals have been given much more role. They have given shared vision. They have been given that role of shared vision, working in tandem with the administrators of the health facility. That's shared vision. And the more you give people shared responsibility, they give out their best. That is lacking in Ghana. Two, the medical biometric scientists are supposed to be given clinical leadership. That is not happening in Ghana. We are only complaining. So, for example, if they are given that much more robust role and responsibility, their leadership will contribute to the whole health system improvement. That is not happening. So by their training, they know they are supposed to do more. And this reminds me of the advert that these children will say, I want more. If you give them that role, they will do more. That we are not seeing. But on a more serious note, the PRO of the Ministry of Health need to come again. We don't want to rain on him now. Because of the situation now, we are cooling tempers so that we can have our brothers and sisters to go back to work, and while government find much more proactive way to soften their heart for them to go, and then they will roll out a national program to ensure. I'm quite aware in 2015-16, the Ministry of Health, Ghana Health, has started a national human resource realignment. Where is that report? That report was supposed to address all health workers in the country so that they are all in their, as the accounts will say, where is that report? So it's not only the biomedical laboratory scientists. That report was seeking to address the mirage of problems that the Ministry of Health, Ghana Health Service has. That is, we want to see that. The other thing I want to draw the Ministry of Health attention is that if you are a leader, you are a leader. Now, I'm not sure the time you took over from your predecessor, you have been complaining about what you met. But you rather aspire to do more, to add value to what you came to do on the stool. That is what we want to see the Ministry of Health doing. In fact, the complaints are too much rather than fixing and transforming. So we are much more following the trend since 2017. And we are soft on this matter because we want our brothers to see that Ghanaians are behind them. But the ministry is their employer. They must be much more responsible in getting the issues much more proactive. You see, Nana, if there's an issue, your body gets alone will let me appreciate whether you are ready to listen to me or otherwise. That is what is happening now.
The posture is not right.
So I'm encouraging the Ministry of Health, they should cleanse themselves and begin to be much more proactive in dialoguing so that they can also cool down their tempers and begin to appreciate. Right now, as I was saying, we have not heard of any casualty. But if this continues in the next 2-3 days, it will not be well.
Let me take a quick break. But before, the number is 0302 211 691 on 692. So 030-221 691 and 692. So right after the break, let me hear if you've had any mishaps. Let's hear from you. Don't go. Well, we're dealing with a serious issue of laboratory scientists, medical laboratory scientists going on the strike. And the number is 030-221 169 or 1691 or 16912. And Kofi calling from Old Barren. Hello, Kofi.
Yeah.
Yes, Kofi, let me hear your take on this issue.
Yeah, good evening and good evening to your viewers and listeners.
Great.
I'm a pensioner from Medical Health Laboratory Services. As a pensioner, sitting back and looking at things, in fact, I'm sure our members do not want any patients to suffer. But I think it is high time for the Ministry of Health or Ghana Health Services to recognize the laboratory assets. As the member was saying, we have come of age where people are even reading PhDs into medical laboratory sciences. Mm-hmm. So I believe it is time for government to put certain things in place. When we were looking for the LI, for example, there were a lot of things that went on. But I think it is time. If you raise the laboratory sciences up, this nation will go up in its medical health services. So I'm pleading with the authorities, the ministry, to do something about this situation. Let us put it to rest, and then let's see whether we are not going to be compared with all the advanced countries so far as the medical health is concerned. Thank you very much.
Thank you too very much. That's an old guard within the fraternity, and it's 0302211 or 692. That was an old guard there, sharing your sentiment that it's time the fraternity had a directorate on its own. Is it a long shot? When is this has to be, done by statute and all that? So when is that going to be provided?
Yeah, it's not a long shot. Like I said, all documents are available. It is stated clearly in these documents that the medical laboratory services must be provided with a directorate. And there are some of the that have been on the record since 1974 and back. In fact, when I entered into the service, we used to have the National Health Laboratory Services, which was acting as the coordinating center for laboratory services.
Let me hold you from when you entered the force, and let me go to Chireponi and speak to Salifu. Hello, Salifu.
Yes, sir.
Let me hear your take on this issue.
Okay. I'm Salifu. I'm calling from Chireponi.
Let me hear you.
I'm a technical officer, laboratory technician. Okay. The case is that we have been deliberating this with government for some time now, and they keep giving us assurances from time to time. Since 2012 up to now, we are wrongly placed on single spine. Our policy is not being handled the way it's supposed to be handled. We are not part of management. They sit in office and they decide what they want for the laboratory, and they give it to us, whether it's good or not. And it's not helping us at all. So please, authorities should listen to us and then find solution to our problem so that the lab can also be strong enough to improve the healthcare system.
Thank you, Salifu. I heard your comment there. So when you entered the...
Yeah, so I was saying that there used to be this health laboratory services unit, which was at the Korle-Bu Teaching Hospital, but it was a national unit that was coordinating all the administrative affairs of medical laboratory. But when the Ghana Health Service and Teaching Hospitals Act was promulgated in 2006, the Ghana Health Laboratory Services was scrapped off. And since then, the coordination of activities of the laboratory has suffered worse, to the sense that recently the Ghana Health Service developed staffing norms. And the staffing norms that was developed, even the regional biomedical laboratory scientists who are at the regional levels representing the laboratories were not taken into consideration in the staffing norms that were developed. So we are realizing that continuously it seemed to be a calculated attempt just to wipe off the services of medical laboratory scientists, or best to say, to bring sweepers or push us down. And my friend Salifu was saying, it is very demoralizing for somebody to work and then the salary being paid to him is not a befitting one. Since 2012, we complained. We went to a complaints and grievances committee. The committee admitted that yes, we have a case, so we should be brought at par with the analogous grade, like the nurses grade and the others.
So at the moment you're below nurses?
Exactly. The technical officers grade and then the laboratory assistant grades are below nurses. The biomedical scientists is at par with the other analogous grade nurses, pharmacists. But when it comes to market premium, the chief and the deputy chiefs had been brought down below that of nurses. And we have all these things. The then Deputy Minister of Health, Honorable Rojo, Rojo Nunu or whatever, wrote to the Ghana Fair Wages and Salaries Commission to correct these anomalies. Fair wages, as we speak today, has still not corrected these anomalies. Several letters and follow-ups meetings has gone on, and still they are not correcting it.
Is it a case of, look, there's no money, we can't fund it?
There was at a point the Fair Wages and Salaries Commission requested us to provide the list of the affected members, and then cost the amount of money involved, so that when the letter is being written to the Ministry of Finance, all this will be cleared. We did all these things and submitted to the Fair Wages and Salaries Commission, and still they have not done it. So we just don't know exactly what the problem is or why they are doing this to us.
No, it's a tough call, isn't it?
Yes, I think that the issue has to do with a broader stakeholder engagement. The Fair Wages Salary Commission, the Labor Commission, the Ministry of Employment and Labor Relations, the Ministry of Finance, the Ministry of Health, Ghana Health Service, the other aspect which has been very silent is the medical directors at the various facilities. You see, if you notice, their problem started from that side. Their recognition is not felt at that lower level. So medical directors find their way out, thinking that without them they can still move the system. But we are talking about quality.
Do you think this move will shock the system so that that recognition comes?
Yeah, they are already enjoying the public support. If you listen to what happened since morning, whereas people were lamenting, everybody is telling government to sit with them immediately. So they are already enjoying the public support. But what can do the trick is to have a holistic stakeholder engagement. And if the ministry is listening, as they are preparing to meet them tomorrow, they should open up to allow much more broader participation. And I hope that tomorrow we will try to be part of it. I hope with the broader stakeholders' participation, the issues will be much more articulated. Then we can find an amicable solution. But if you talk to me as a mediator or as an OD person, what I will say is that they need to have somebody, a specialist, who can facilitate the discussion. And the ministry should create an attitude of willingness to listen and take responsibility.
All too soon, that's what time would allow us.
The association will also be willing to see that they may not get everything at the table.
So they meet somewhere halfway.
We have so that we move ahead.
Well, tomorrow,
and that is
Tuesday,
very important.
Yeah. 29th on Tuesday is this great meeting, and let's hope that cool heads are met and they agree somewhere, because indeed to be sent to a lab where there's no lab technician and you want to know whether your cholesterol is high or not before you're put on a medication, whether your BP is high or not before they put you on medication, it's very vital. But the number is 024-366-2001, 024-366-2001. That's Tanti's Fashion. They provide the shirts for the show, so give them a call and get yourself a nice shirt yourself. But thank you very much, gentlemen, and to you at home, we'll be back to do this all over again. Thank you for watching.
Thank you.
Thank you.